Thank you for joining us on Kelowna Now. I'm Jim Check. I'm sitting down here today with Fraser Johnson of Entheotech. Maybe just kind of give us an idea of, well, first off, psychedelics. That's what we're going to talk about. We're going to talk about psychedelics. Steve Jobs liked them, right? Yeah. And then there's lots of other uses, though. Why don't you just tell us a little about Entheotech?
Absolutely. Thank you for having me, Jim. So Entheotech is a company focused on innovative treatments for chronic pain and mental health. So what we've been developing over the last couple of years is what we call Odyssey. So that is our psychedelic-assisted therapy model. So a really innovative way that we're helping people with everything from depression, anxiety, PTSD, and burnout.
So psychedelics, explain it to some people that don't know what that is. So what is a psychedelic?
Great question. So psychedelics are essentially tools and molecules to help people break down their regular thinking patterns or maybe kind of reframe things that have happened in their life. So they're really useful tools to help you go into an experience with the correct kind of support and therapeutic setting to help you feel safe and comfortable to be able to explore your inner world. And then you can essentially extract information out of that or kind of reframe some of the problems or relationships in your life.
So how would the common person understand what a psychedelic is? Like what type of, it's a drug of some type, right? So what is that kind of like if you were to break it down into the common man, what do they expect?
So consciousness altering drugs, you could say. Yeah. So I guess in this psychedelic space, we try and get away from the term drug and more use the term medicine too.
Therapy kind of thing, right?
You got it. So drugs in our society have a very, I'd say, unusual connotation. Yep. So lots of people associate drugs with, crack, cocaine, methamphetamines, pharmaceutical drugs. Yep. Whereas psychedelics are things that help alter your consciousness and your normal frame of reality.
So getting back to Steve Jobs, he liked LSD.
Yes.
He's created some great things with it, I guess. Oh, yeah. Is LSD kind of in that psychedelic world?
Absolutely. So there's a whole host of drugs in that psychedelic category. So probably the ones lots of people have heard of, LSD, acid, magic mushrooms, other called psilocybin, ayahuasca.
That's the one I hear a lot, psilocybin, right?
Yes. That's probably the one that's going to be most popular in a kind of legalized setting as well. Ketamine sometimes falls under that psychedelic framework, and then as well as MDMA too.
Okay. So when you're doing therapy, is it taking a blend of certain things, or or depending on what the person's kind of suffering from is how you kind of...
If you want to have a party, Jim, you can take a blend. But we use, currently in the clinic right now, so maybe what we could do is talk a little bit about current regulation in Canada. So in the clinic right now, we actually use intramuscular ketamine. So that's an intramuscular injection into usually your deltoid. So ketamine, so how we set people up for that is everyone does a physical and a psychiatric screening to make sure they're suitable for treatment. Okay. They would then do kind of a preparatory counseling session with a psychedelically trained counselor to help them prepare or set an intention for their experience. They would then come into our clinic where they have that intramuscular ketamine dose delivered with medical supervision. So we have a doctor and a nurse present for them, helping that person feel safe and be able to comfortable to go to that inner world. So you have a blindfold, headphones, and a blanket on.
So you kind of take away all of their sensory.
You got it. So the big place where people would usually freak out with psychedelics if they're at a festival. So that awareness is going external at a festival, and it can be very sensory.
Too many things kind of like coming at you.
You got it, Jim. Yeah. So what we try and do in the clinic is encourage that awareness to go inward. And that's really where people are having these profound transformational experiences. So once someone has that experience in the clinic, within 48 hours, they do their integration counseling session, really to help ground them and integrate some of that experience. And then we also provide an app called Odyssey Online that gives people things like breathwork, meditation, yoga, somatic techniques.
Would hypnosis kind of been something like that at some point? Like, it's because a lot of people do that deep hypnosis too, right?
You got it. Great point, Jim. So people are actually experimenting with that in a therapeutic setting right now. So for instance, under the influence of a psychedelic, having someone do hypnosis on them, which, smoking cessation, alcoholism. So there's actually some pretty cool science going on in the space right now.
So I guess the biggest question I would have if I was to go and do it, what's the chances I get addicted to something and I end up on the street looking for stuff?
So great question. So psychedelics are actually anti-addictive when you look at the more kind of traditional ones like LSD, psilocybin. When someone does those, they're not instantly creating that craving to want to do it again. So whereas when you look at something like ketamine, there could be potentially addictive effects of that. However, when we do it in that medical clinical setting where you need a referral from a doctor, we try and put those safeguards in place. And the real cause of addiction is someone trying to mask something in their inner world or an emotional turmoil. So actually with these psychedelic experiences, we're trying to heal that root trauma and heal that actual root cause of addiction.
So with ketamine, maybe explain ketamine, because that's new to me, ketamine. I've seen it in some, I think I've seen a lawsuit on something where a young lady or something like it, but I don't know much about ketamine. Explain it to me.
So ketamine is a dissociative anesthetic. So it's actually got a pretty interesting history. So ketamine's got a huge safety profile. So, I mean, dentists use it for kids. They use it in the OR to set an arm break or something like that. So very safe drug. But they actually started to find out some of those interesting psychedelic qualities. So when you have a larger dose of ketamine at those intramuscular doses we give it at, you essentially lose your body. So you disassociate from your body, and then you're in your kind of mental scape. So it's a very interesting headspace that you get into.
I've had morphine before. Is it similar? Morphine, because I've had an accident. Like I had some accident. They did some surgeries, and morphine. It sounded like it felt like an out-of-body experience for me.
Similar. You could probably compare.
Like they could pull your fingers off, and you're just like, cool.
Yes. So ketamine does have that dissociative quality to it. I'd say it's a little more psychedelic than morphine, though. For sure.
Okay. Yeah, because I remember when I had the morphine, I was having a conversation with somebody, and then I think I passed out for 4 hours. I woke up, and to me, time didn't pass.
Yeah,
right?
yeah. Well, that's the interesting thing. So in our clinic, people are usually in the experience for an hour, hour and a half, and you can take your eye shades off, and they're like, it was 5 minutes, and you're like, it was a while.
So what are the rules, and how, like, where are we at in this highway of progression?
Yeah, ever evolving space, Jim. So right now, for ketamine in Canada right now, it's legal for off-label use. So essentially, a clinic like ours, we can legally give that to people when they have a referral from a doctor. So that referral could be anything, burnout, depression, anxiety, PTSD, OCD, postpartum depression. There's a pretty wide spectrum there. Whereas things like psilocybin and MDMA are only legal under the Special Access Program. So essentially, that's a one-off application.
That's kind of psychiatrists and stuff like that?
So it's Health Canada that's actually approving them. So it's a one-off application every time. It's like this big behemoth application. And that's for severe conditions. So the ones we've had approved for psilocybin have been end-of-life distress, so terminal cancer patients, or severe PTSD that we had our MDMA one approved for, or severe anxiety. Yeah.
So what's the typical, like somebody gets a ketamine treatment, what is their typical path? Is it like how many treatments and what's the progression look like?
So good point. So in terms of how many treatments, that totally depends on, I'd say, severity of the condition or what condition they're actually coming in for. So someone that has potentially treatment-resistant depression, they usually say the sweet spot in terms of treatments is kind of 3 to 6, and you can see people get completely off their antidepressants or have a real shift in their mental health. For someone who's maybe got lower level anxiety or, for instance, burnout, say they've got a really stressful job, they could have 1 or 2 treatments and, be a complete shift in terms of their personal or their mental health.
So maybe paint the picture for people 5 years back, where we are now, and where we're going, kind of thing, or where we hope to get to, I guess. In this therapy, in this I guess this basket of therapy drugs, right?
Totally, Jim. So I mean, you could go as far back as 60 years with the war on drugs. So I think that's really what set up how our society looks at psychedelics, because it's always these things, I'm just going to go crazy, or there's no therapeutic use to these because they're all scheduled as scheduled.
Well, I mean, we see the opioids, right, and what it's doing to our society, right? And I think we think, like a lot of people think drugs bad, right? But obviously,
yes,
we use drugs all the time, from a headache to whatever, right?
Drugs that help and drugs that hurt, for sure.
Yeah, for sure.
So war on drugs really kind of what I'd say distorted our view on what these drugs can do or their therapeutic potential. So really, I'd say in the last 10 years, you've seen a lot more universities, etc., start to do studies on things like psilocybin, LSD, DMT. Places like Imperial College London did that big study on DMT with intravenous DMT. Amazing results in terms of depression there too. So really, over the last 10 years, you've started to see regulators or healthcare professionals go, well, hey, okay, there's something here. There's something happening with these drugs. And especially when you've seen the large mental health epidemic explode over the last 5 years, and then especially during COVID with isolation and everything.
Right.
really in the last kind of 5 years, it's been under a microscope in terms of, okay, there is therapeutic value here. How do we bring this into mainstream healthcare in the appropriate way? So when you look at cannabis, that was a recreational dispensary model that we kind of brought that to the world in. Psychedelics will be a medical clinical model.
So cannabis, which was brought in, and it's basically, in most of Canada, you can use it, I think you can anywhere in Canada. How does that kind of where does that kind of fit, when you talk about LSD and where does that kind of you know what I mean? Like cannabis versus LSD. Because I know there's some medical treatment cannabis too, right? Because they used to give out medical cards for it, right? Like I was just in Hawaii and you still needed a medical card there.
Yeah. So cannabis is amazing for things like pain relief. Some people have great kind of therapeutic value on anxiety from it. I'd say psychedelics as a whole have way more therapeutic value than cannabis does for mental health conditions. A lot of the time you see people with excess cannabis use, they can end up with psychosis or things like that. Whereas I think when psychedelics are done in that controlled medical clinical model, you're actually seeing a lot more therapeutic potential coming from things like depression and PTSD.
So your company started how long ago? When did you guys start?
So we had our 3-year anniversary, Jim, December 21st, 2023. So we've been treating patients for 2 years. So the first year was pretty much building the team, building the medical model, raising our seed round, and then getting insurance was actually a bit of a nightmare for us to start with. We went through kind of 8 different carriers that were just like, no, as soon as they heard the word psychedelics or ketamine, they wouldn't touch it. So that was a big learning curve for me, just to start to learn about the stigma out there around these drugs too.
And then business is obviously increasing as you move along, and it's a small world. We know some people in Calgary and stuff like that. So, and I know that group was really pushing for more, I guess more involvement with the medical field, and to try to get it into better treatments and stuff like that. This is actually very new to me. How do people find out more? I guess where do they go to find out more information? And how do they find out if they're suitable for this treatment?
Great question. So our website's actually called entheomed.ca. That's the name of our clinic. Or you can go to odysseymethod.com, which is the name of our therapy model. So literally on there, we have an eligibility criteria that people can read. There's an FAQ in there. And you can also just inquire with our care team and they'll take you through the process. And then everyone, if they're feeling comfortable, can do a psychiatric screening and then that physical screening to make sure they're safe for treatment.
And how long, and you're saying it depends on the individual, but it's usually 4 or 5 treatments or something like that?
Yeah, so we've had working professionals that have done one treatment and be like, holy, I've had an epiphany. But some people, we usually see them come in, once a quarter, once every month. It just really depends. And some people as well will have that big kind of profound experience and then we'll get a call from them a year later and say, hey, I've just felt a bit of a dip in my mental health. We'd love to come back in for another treatment. So
have I missed anything that you think people should know?
Oh, Jim. You asked a good question earlier about the synthetic natural debate. So that's always an interesting one for people. And I'd say the main thing to think about with psychedelics is the idea of standardization. So when you look at a medical clinical model or the underground, as they like to call it, so in cannabis there was a white market and a grey market. Yeah. Same thing is happening with psychedelic therapy. You have people who've done psychedelics a couple of times and all of a sudden they're a self-proclaimed shaman and they're doing psychedelic therapy in their basement with people.
They're out in the woods finding their own mushrooms.
Yeah, you got it. So that's what we're really trying to say is, okay, yes, people can have good experiences with that, but they've also had horror experiences. We've heard some crazy stories. So that's really what we're trying to do, is create a safe therapeutic model for people where it's standardized, the medicine's standardized, so they know exactly what dose they're getting. There's nothing weird in there. It's not been cooked up in someone's bathtub. It's all pharmaceutical grade product.
So is the synthetic variations very similar to the organic ones?
Totally. So if you took a synthetic psilocybin and natural psilocybin, you probably, I guarantee you wouldn't be able to tell the difference. Some purists would say, oh, there's not a spirit in the synthetic.
I've seen the beakers. I actually toured one of those facilities.
Yeah, it's pretty wild, hey?
It's pretty wild, for sure. Yeah.
So, but honestly, and most of the blind studies they've done, people have been like, I couldn't tell if it was natural or synthetic.
Okay, that was great. That was awesome.
Beautiful, thank you.
Maybe we'll do it again.
Yeah.
I think that was awesome. I think, the more information people get on anything, right? I think it's very helpful, right? Because then you can make a more informed choice. And I think that's what most people want to do, is make a more informed choice.
Yes, absolutely. Right? Yeah, education's key, and then just really starting to take the stigma away from this as it comes into mainstream healthcare, and then insurance and benefits start to come online.
Oh, right. You were saying something like this. So are they covering it right now, or is that something that's kind of being worked on?
So interesting. So I guess the key term for people is like direct billing. So the interesting thing for us is people have to pay up front, and then you can submit to their insurer on the back end. We've had some insurance companies like Sun Life or Great West Life cover like up to $500 of the treatment.
Because most people have chiropractor, RMT. Where would this fall under then? So psychological, kind of like?
Yes, psychological therapy. So we're actually, where we're having a lot of success, Jim, on the kind of insurance and benefit side is actually employee health spending accounts. So
so they can spend more.
Yeah, a little more nimbler and more flexible than these kind of big behemoth insurance carriers.
Right.
So that's where they're saying, okay, we're a little more innovative with the treatments we're offering on here. Right. So that's actually, I think, where we're finding it first come in as a beachhead for us.
That makes sense. Absolutely. And I thank you for coming in.
My pleasure, Jim. Thank you so much.
Thank you for watching Kelowna Now.